What's up, guys? Today in this video we're going to be talking about the IT band, or the iliotibial band. We'll be talking about what it is, what people are usually predisposed to that injury, and some therapeutic methods that you can implement to recover from that injury. I have my dad here, or John. He is a physical therapist. He'll be a little bit more versed in talking about this topic. So let's get into this.
I'm going to do my best to talk about the anatomy of the IT band, and we'll talk about its origin and insertion. This is the top part of your leg, the femur, and this is your tibia and your fibula. So the band does come across the knee joint and attach to the lateral tibial condyle. This is your pelvis, and the band begins with two muscles from your pelvis, the gluteus maximus and the tensor fascia lata. So that's the band's insertion. As it comes down the outside of the leg, the lateral aspect of the leg, it starts to form into more of like a 4 centimeter band. And that band runs down the outside of your leg, sort of splits in two, and it attaches to an area called Gerdy's tubercle, or it attaches to the tibial condyle. Okay, so now I have the right knee joint in an upright position, and just to get you oriented a little bit better, this is your quadriceps, this area here, and your patella tendon. This could be the lateral collateral ligament or a part of the biceps femoris tendon. And as I said before, the IT band comes down the outside of your leg here and attaches to that lateral tibial condyle, or Gerdy's tubercle, right about there. Now there is one other structure that I wanted to talk about, and that was that there is a bursa sac that separates your IT band from the condyles of your leg, and that also can get irritated with this type of condition. I wanted to show you here in this picture that at around 30 degrees of knee flexion, bending your knee to about 30 degrees, that's when the IT band puts most of its pressure on that lateral tibial condyle. So at about 30 degrees, you get most of your friction occurring between the IT band and that lateral tibial condyle. So let's talk about the initial treatment for this type of condition. Firstly, people need to rest, start to have some activity modifications, especially long distance runners. The second thing is, you want to ice the condition and start taking some anti-inflammatories. Probably want to check with your doctor on that. And then you can do some strapping, a little bit of compression. Perhaps if you have pronated feet, getting some orthotics or trying out some over-the-counter arch supports to see if that makes a difference. For runners that want to continue to run while they have the condition, besides lowering their mileage, they may want to take a little bit less of a stride, or see if they can run with a different stride length and not have the symptoms, so they don't lose any aerobic training. So now the question is, what type of folks get IT band syndrome? Well, you think about it, the friction is the main cause of the inflammation. So people that do repetitive movements, long distance runners, skiers, people that run that IT band with a lot of force across the tibial tubercle, like a weightlifter. Basketball players are people who jump a lot. People that have a condition called genu varum, otherwise known as like being bow-legged, or somebody who has excessive flat feet. Other things could just be a genetically pronounced lateral tibial tubercle. So these are the type of folks that we see in physical therapy for the IT band syndrome. So now I just wanted to show you some tests for the IT band syndrome pain people have around their knee joints. So again, like I said, most of the friction occurs at about 30 degrees of knee bending. So this is a goniometer, a rather small one. Completely straight is 0. You want to come down about 30 degrees, and then what you usually do is you apply a little bit of pressure to the inside of their leg, which puts more pressure here on the outside of their leg, and then sort of move their leg through that 30-degree range and see if they have any symptoms. If a person says that causes the symptoms, that's usually a pretty good indicator that they have IT band syndrome. So another test that you can use for IT band syndrome is to have the patient standing and then have them stand with all their weight on the affected leg, and then have them come in and out of that 30-degree flexion. So they're going to bend their knee maybe to about 40-50 degrees, then just kind of come back in and out of that, say, 50 to 20 degree bending of the knee, and see if you can elicit any of those symptoms that they're complaining about along the outside of their leg. So in this stretch for the IT band, the origin of the muscles up in this area here and the insertion being down in here, you want to stay on your side with your affected leg on top, and then just kind of bring that back on a table, and then let this leg drop towards the ground. It's a little bit easier to do on a table than it is to do on a bench. But so you want to feel this whole IT band stretch. And this is also an indicator of whether or not your IT band is tight. Part of the stretching is just trying to relax the leg in this position. And when you get there, hold it for about 20 to 30 seconds. And I would do at least 3 of those, 3 times a day. The next exercise I'm going to show you is in the standing position. So you're going to hold on to something. You're going to take the affected leg, in this case it's my left leg, I'm going to bring it behind my body, and I'm going to rest my foot on the outside of the shoe. So right now I'm resting my foot on the lateral aspect of my shoe. And then once that's stabilized, the lower part of my leg is stabilized, I already feel a little bit of a stretch. I'm going to lean towards that leg, and you'll feel a stretch pretty much all along the lateral aspect. In this case, it's my left leg. And then I'm going to try to relax into the stretch, and once I relax, hold that position for about 30 seconds. So I would do that 3 times, and at least 2 or 3 times a day. One other thing I wanted to mention too is it's good to be warmed up before you stretch. So if you do a little bit of bicycling, a little bit of walking, or it actually just put some heat on that area, it'll help with your stretching. Okay, the third and final stretch I'm going to show you today involves you lying on your side. You can lie on a table or on the floor, and you're going to have your affected leg, in this case it's his right leg, on top, and he's lying on his left side, and he's going to put one of these fitness loops, straps that has a lot of loops in it, around his right leg, and you're going to get a stretch from gravity in this direction, and then he's going to gently take his leg up towards his head in that direction with the strap until he feels a stretch, and then once he feels that stretch, again relax and then try to hold it for about 30 seconds. 3 times each side, 3 times a day. And while I have Chris in this position, I'm going to show you one other thing. A lot of times people benefit from strengthening their gluteus medius when they have an IT band syndrome. So one of the strengthening exercises you can do is lay on your side, bend your bottom leg bent, top leg straight, and come back past the plane of your body. And what you're doing is a side-lying abduction here, and that works the gluteus medius. And what that does is perhaps take some of the strengthening or some of the work off of the IT band. So I also add that into my patients' exercises when I'm treating an IT band.
Alright guys, thanks for watching. If you have any questions, comments, leave them down below. If you could give me a like, subscribe, that'd be awesome. And I'll see you in the next one.